So when we talk about your position being the medical director of the trauma program, what does that entail?
So as the director, I should say it's the Kessler Trauma Center at the University of Rochester. And as the director, I'm responsible for just kind of the general organization and general day-to-day activities of the trauma center. So working with the physicians, the nurses, all the other care providers, making sure that we are able to do what we do 24 hours a day. And that everybody is up to speed. Our policies, procedures are compatible with what else is happening around the country. We're a verified trauma center by the American College of Surgeons, so there's a lot of administrative work involved in that, keeping us verified. There's a cycle every 3 years. You have to kind of re-up, if you will. Mm-hmm. So we have to, so that all falls to me.
So if there's a shooting somewhere in our area and the patient is coming to Strong Memorial Hospital, what happens with you? What do you do?
Well, so first of all, I represent a team. So whether it's me or one of my partners, there's 8 of us who do this work 24/7. We'll usually get some advance notice that somebody's coming, and we'll report down to the emergency room where there's a team in place to receive the patient, whatever the emergency is. In the event of a shooting, there's a slightly higher chance that that patient's going to need an operating room. So as part of our designation as a trauma center, we have to be able to do all of those things at once. We have to be able to do a resuscitation in the emergency room, but then we also have to be able to follow up with surgery if it's needed 24/7. So having that infrastructure in place is really important. So we would, to respond to your question directly, we would be in the emergency room, we would see the patient when they first arrive, make an assessment of what the issue is, and then deal with it. So if we have to surgically deal with it, we have the capability to do that kind of right away.
So you see the impact of gun violence up close?
Every day. Every day.
What is that like?
Well, it's what we do. So it's a big part of what we do. The University of Rochester covers a very large area. So we see gun violence predominantly from the city, but then we see trauma from 17 counties. So it could be agricultural, motor vehicle, motorcycle, industrial, any of those kinds of things. But the gun violence it takes its toll.
In what way?
Well, I can tell you I've been in this community for 20 years, and I think it's worse now than I think it's ever been as far as what I see. I think when I moved into this community, the homicide rates were 60 a year or something like that. It came down precipitously over the next decade or so, and then now things are really kind of creeping back up. I think we're at 25, 26, something like that, and we're only in the beginning of June. We have a ways to go before we're done with the year. So and for every people easily look at mortality, people who died, but you don't see the toll of every you have 2 and 3 people shot every night, that's a lot. That's a lot of what I consider to be pretty senseless injuries because these things didn't have to happen.
And I've often thought about that. Those folks who live, a lot of them are probably going to live with that pain or the repercussions of that for the rest of their life, I would think.
Well, that's definitely true. So, so if you're lucky enough to be shot through something that doesn't matter, then you're healed, and a couple of months later you're back to normal. But many times, like you said, you have a spinal cord injury, you end up needing a colostomy, end up needing multiple surgeries. So you're not dead, and I think that's a testament to modern medicine and EMS care and all those kinds of things. But at the same time, you're going to remember that this happened, and it's going to affect your life. It's going to affect your family. It's going to affect your ability to work. It's going to affect pretty much all aspects of your life going forward. And we focus on homicide rates, but we don't pay attention to what happens to the shootings. And when we've looked at it, the numbers for shootings are way above what the homicide rates are.
Oh yeah, absolutely. And this impacted you as well. It prompted you to try and work on the larger problem. How did you go about doing that?
So we have a couple of different things that are going on, and these were all kind of brought out through the process of the FBI award. The thing that I've been involved in for the longest is something called the Rochester Youth Violence Partnership, and that was something that was developed by 3 of us at the university, so a social worker, an adolescent psychiatrist, and myself. The 3 of us independently started to realize that we're taking care of young people who are coming back to the hospital over and over and over again. So there were 2 specific kids, if you will, young people that kind of triggered our program. And the first was must have been 13 or 14-year-old kid who was shot in the butt. And he came into the trauma center, shot in the butt, and he was absolutely furious, right? Not that he was shot, but the fact that the bulletproof vest that he had didn't cover the area where he was shot. So we started to think, why is this kid getting up and putting on a bulletproof vest in the morning? There's something wrong with that, right? So that was the first kid. Then there was a second kid who was shot when he was 16, like in the leg or something like that. We treated, released him. He was shot when he was 17, came back again, this time shot in the arm or something like that. And now he's, 17 and a half, 18, he comes back shot in the head and he's dead. And it caused us to wonder, was there something we could have done differently? Could we have done something to change this path? So out of that, this program grew, and there's multiple people involved. It's certainly not just me, but the idea is to identify kids, young people. At the time, it was focused on under 18. Identify kids who are at risk, and see if we could do something to help what the situation is. So many times, their parents didn't know where they were. You get shot at 2 or 3 in the morning, and you're a 14, 15-year-old kid. Why are you out at that hour? And does somebody know that? And what can we do to kind of prevent that sort of, maybe you're not doing something wrong, but you just happen to be in a situation where you're going to be increased exposure. And then, all of those things. So sometimes there's psychosocial needs, sometimes there's financial needs, sometimes there's safety type things. But it turns out Rochester's a pretty resource-rich community. And what we did was we put this group together, kind of led by the hospital, but still with multiple partners to say, look at each individual episode, if you will, and say, all right, well, why is this happening? This is happening because the kid's involved in a retaliation situation, so maybe we can offer the opportunity to move this kid somewhere else. And working with the school district and with the police department and with a number of social agencies around town, we were able to really do that. It's hard to say that your efforts resulted in a shooting not happening, but we can say that for a period of time we saw these kids weren't coming back. So we knew that was a positive sign. And on a family level, you could, this particular kid, you could see what, the influence that you would have on this particular kid and his family, and the opportunity to kind of make the point that these things don't happen by accident. Most people go through their entire lives without getting shot. Here you are 14, 15, 16, you've been shot several times. That's not really normal. So what can we do to help make that, make that not happen anymore? And I think from the hospital point of view, like I said, we've been doing that for over 15 years, and I think that's been very productive. So that's the first thing we do. What we've done recently now is we've expanded. I said early on, this program was targeted toward young kids. So we focused on the under 18 because there's a number of child protection laws that you can apply to these situations. But then through the support of Pathways to Peace, which is part of the City of Rochester, City of Rochester has this organization, which I'm sure you're familiar with. Through their help, we were able to expand it now. So we look at people 25, 26, 27 years old. The only difference is the older you get, you have a little bit more ability to say, no, thank you, I don't want to participate. But we have the program in place, and we offer it, and we really try and encourage people. Sometimes the patient doesn't want to do it, but the family really steers them toward it, whether it's a wife or a girlfriend or a mother or an aunt or something like that. Once they realize these programs are available, we really work hard to try and make people see that this is a preventable problem and give them tools to try and prevent it in the future. So that's kind of what that was about. On the opposite end of the equation, trying to work with responsible gun ownership. So I don't know if you want to talk about that. So that's a kind of a new program that we're developing, once again with community support. And that's targeted, if you will, maybe that's aimed at a kind of different problem. So that deals with somebody who has a legally registered handgun, and how are they safeguarding that weapon, right? We have a right to own weapons, but we have a responsibility to safeguard those weapons. And it's a significant problem in our area. Guns are stolen. They're stolen from cars, they're stolen from houses, they're not properly secured, and that's a failure, right? So if you have a legally registered handgun and it gets stolen, that's on you if you didn't have it locked up, right? So how can we educate people about that responsibility? And at the same time, it's a little bit more maybe complicated to talk about, but you have a legally registered handgun in your house. How do you protect it from people in your house that maybe shouldn't have access to it? So you might have a child, you might have somebody who has alcohol problems or drug problems or psychiatric problems or something like that, and that's an individual equation. Everybody has their own situation, but making sure that you're aware, making sure you have resources to know what to do with that weapon and how to properly safeguard it, giving people options how to get rid of their weapons if they don't want them anymore. A common problem is somebody will die, a registered gun owner will die, the gun is in the house, the family doesn't know how to get rid of it. So, if they want to keep it, this is how you make it legal. If you want to get rid of it, these are all the options you have for properly, turning in that handgun, selling the handgun, moving the handgun along. So, we're kind of looking at that problem from several different areas. And, So one of the things that I do on the side is I'm part of the Project Exile Community Board, and I don't know if you know what Exile is, but one of the things that's become clear from my participation in Exile is handguns that are stolen end up as crime guns. So that in our area, that number one source of crime guns is stolen guns. So you think your car gets robbed, your gun is stolen from your car in one of the suburbs, and you think it's a nuisance. Well, it's not a nuisance because that gun is now in circulation. That gun circles back to what we were talking about before, and it could very well be responsible for some of the shootings that we're seeing. So I think coming at this problem from both sides really makes sense.
You've put in all this work, the one program starting 15 years ago. Is it disheartening to see this rise in gun violence given that investment?
Well, of course. I mean, certainly you don't want to see more of this violence. I can tell you nationally, it's been a strange couple of years. So with COVID, people being inside, the economic impact of COVID, the job losses associated and the business closures and all the craziness associated with that, it's not just a Rochester problem. I mean, penetrating injury, violence, assaults, things like that have been significantly elevated in cities around the country. So I think part of this is related to the pandemic. I also think, New York State laws have changed a little bit, and I think we're still in flux in terms of how the criminal justice should work, criminal justice system should work. But I personally am seeing more and more people who are on parole turning up as either offenders or as victims. Probably shouldn't be happening, and I think probably somebody needs to look at that. I think that's an artificial, effect maybe that we're seeing, but it's clear. I mean, we haven't even started the summer. I mean, we're just starting June, and our numbers of shootings and homicides is significantly higher. And if you think the first 3 months, the average temperature is 30 degrees, right? Right. So it's only just getting warm. So I think there's a lot of factors, but certainly it all ends on our doorstep. There's no question it all ends on our doorstep because, as the trauma center, the ambulances are bringing these patients to us. The patients are showing up on their own to us, and as much as we can impact what's happening, we would like to. Obviously, it's way more than just the hospital side of things. There's a lot of things happening, but it does end with us, right?
Yeah, and you end up talking with a lot of the patients, I'm guessing, those who are conscious, and what kind of things do you hear from them?
It's completely varied, but most of these, when you talk about the violence, most of it didn't need to happen. I mean, in retrospect, people look back and say this really didn't need to happen. I mean, we have some, I'm sure every community has people who are, hardened criminals, and they're going to do this as part of their day-to-day activity, but that's the minority of cases that we see. The majority of this is you're out at the wrong time in the wrong place, and bullets start flying, and the bullet might not have been intended for you, and you got shot. People realize that maybe I shouldn't have been there, I shouldn't have been with those people, I shouldn't have been engaged in that opportunity. So many times we can get people to see that, this doesn't have to happen again. You have to be careful it doesn't happen again. But for the most part, we see people who are happy that things have ended well. We see families who are happy that things have ended well. And we very much try to deliver the message that, this really didn't need to happen, and we're very happy that you're doing well, but now what can we do to prevent this from happening again? But sometimes somebody's just a crime victim. It wasn't their fault to begin with, right? I mean, we've covered, you guys have covered recently people sitting in their house getting shot through the wall, people sitting in a church, it's not their fault. They didn't do anything to deserve that. So that's, to me, a sign of the escalating violence and the brazenness of people who would, in the middle of the day, fire a weapon at a church, for instance. That's not okay. And I think, from a public safety aspect, politics aside, that's not okay. And I think, we would very much like to see that kind of stuff stop.
Yeah, my last question for you. Earlier in the conversation, you said that it takes a toll. How do you manage the stress and the emotional impact that can come with this job?
Well, so, I told you I work with a very talented group of surgeons, and we're all kind of lifers in this field. This is what we do. So I think most of us have coping mechanisms to deal with that. I think the bigger aspect that we pay constant attention to is the learners, right? So we're a medical school, we have a surgical residency program, and part of doctor training, if you will, surgeon training, is that they spend time with us. And I think, those are the folks we worry we have to be a little bit more careful because they're in the front line. They're on the front lines with us in these situations when when these things happen, and we definitely do debriefs afterwards. There's wellness types of programs in place at the hospital. We also do that with our staff. Whenever there's a significant event, there's always some sort of a critical incident debrief, similar to what EMS would do. And we would bring our, the multidisciplinary teams with respiratory therapists, nurses, techs, those kind of folks. We'll get them all together and kind of talk about what happened, how it went, and those kinds of things, and how people feel about it. But I tell you, it's a pretty professional group, and we see an awful lot of this kind of stuff. So, it's not like we're having debriefings every single day, but there's big events that happen in the community. We have cars that jump up on sidewalks and kill innocent families. So those are the kind of things that really kind of hit home, because we tell people don't walk in the street, don't ride your bike without a helmet, those kinds of things. But here, you have families that are minding their own business and get run over by an errant vehicle. Those are the kinds of things that everybody immediately starts thinking, this could have happened to us, this could have happened to my family, this happened in my neighborhood, those kinds of things. But you're right, it's stressful work. We do our best to make sure that people have the support that they need, the help that they need, and that they're not doing this every night. So we have a big enough team, so we're rotating people around, because I think burnout's certainly a concern.
Mm-hmm. Anything else you'd like to add that I might have missed?
Let's talk about Stop the Bleed.
Yeah,
let's talk about that, because I walked past your boxes, and I want to talk to you about that afterwards. So Stop the Bleed is a program that is basically focused on the concept that the most preventable cause of death after injury is bleeding. And just like CPR and the Heimlich maneuver, the bystander has a critical role to do something before EMS gets there. And all of these programs are focused on what do you do to keep a patient alive until help gets there. We're not making doctors or surgeons. We're empowering people to take action before help gets there, right? So in the case of Stop the Bleed, it's all focused on bleeding control. So, being able to apply direct pressure to something that's bleeding, being able to pack a wound if you need to, or being able to use a tourniquet if you have access to it. So we teach people. The trauma center is actively engaged. We're one of the leading centers in New York State teaching this, but it's being taught around the country. Close to 2 million people now have been trained, not just by us, but around the country, in how to do this. There's multiple success stories, related to this, but essentially, something that developed out of the multiple casualty kind of scenario really morphed into something that's much more applicable to society. Like if you're at a soccer field and your kid falls and gets cut on a rusty spike, if you're in a motorcycle or a hunting accident or an industrial accident, those kinds of things, having the knowledge and feeling empowered to do something, even in the short term, has saved lives. And then the other component of this, which we're working very hard on now, is trying to get bleeding control equipment into the public space. So related to, just like defibrillators, no different. You learn CPR. CPR is great. CPR with the defibrillator, much better, right? So there's a system in place in your public area. You look around, there's generally one of those AEDs hanging somewhere, right? So we've done a lot to try and co-locate bleeding control equipment with those defibrillators so that people know where to go. The stuff is cheap. It lasts for a long time. There's really no harm in having it there. We teach people how to work tourniquets, but we acknowledge, what's the point of teaching them to work a tourniquet if they don't have a tourniquet, don't have access to it, right? So we spend a lot of time with different groups. So we go with hunting groups, motorcycle groups. I mean, if you're going hunting, there's really no reason you can't have, a $25 tourniquet in your bag, and God forbid, the gun goes off and you shoot your foot off and you're in the woods. You can help yourself a lot before somebody is able to come in and provide first aid. There's really no reason you shouldn't have one of those things, and we make people aware of that. And many people, after they've played with it for a couple minutes, realize it's pretty straightforward, pretty common sense, and pretty simple. So the other thing I could tell you, just maybe as a last comment, we've worked extensively on this with law enforcement, and we recently, the end of May was there was a National Stop the Bleed Day. And we went to the Rochester Police Department as one example, and we recognized, I think it was 10 or 15 officers who that year had saved a citizen with one of these bleeding control techniques. So I vividly remember one case where a woman was shot in the neck, and the first police officer who arrived, blood was hosing out of this lady's neck, and she had a carotid artery injury. So if you wait, that's not gonna go well, right? And this officer put pressure on that wound and kept that lady alive until she got to the hospital. And it was, that's a perfect example. We had multiple more that placed tourniquets. Police officers carry tourniquets. partially to take care of themselves, God forbid they need it, but they're also first on the scene for many of these situations. And we recognize those positive interactions where, like, first officer on the scene saved a life. And we've done that with the Rochester Police Department. We spend a lot of time with the state police doing that because they're in big rural areas. They're by themselves for a long time, multiple miles between humans in some of those areas. All right, so they're many times first on the scene. We've worked with rural EMS. We've worked with rural police departments, and just, you know, teaching those skills. They're very simple. We can do it for, you know, usually under an hour. Most times it's half an hour. The training is free. We do it all the time. So I would refer people to stopthebleed.org if they're interested to learn more, and the University of Rochester would be happy to provide that kind of training for anybody. So whether it's a school group or a community group or a specific, you know, like I said, a hunting group or a motorcycle group or something like that.